Hi, my name is Sheri Burke. I'm with International Patient Facilitators, and I'm sitting here with Dr. Sergio Verboonen. He is a grand bariatric surgeon here in Mexico. Dr. Verboonen, how are you?
I'm fine, Sheri.
It's nice to see you.
Nice to see you too.
We've been working together now for 10 years almost a decade.
Yes, 10 years already.
And you've been operating bariatrics now for 18 years, is that right?
Yes, 18, almost 19, but it's very similar.
I'm working with the international patients for that long as well?
Yes.
Same amount of time?
Yes.
Okay. So what is your specialty? Let's talk a little bit about Dr. Verboonen. Who is he? And a little bit about your schooling and a little bit where it all began.
Well, I am a general surgeon, but all my life after my residence, I love the bariatric surgery. I only do bariatric surgery now, and I love the revision surgeries. Bariatric revision is my favorite.
So bariatric revision is when a bariatric patient has failure in a procedure?
Exactly. If any patient with lap band or another kind of procedure, another gastric band with not adjustable, something, any ring, something could try to lose weight and the patient is not happy with that bariatric procedure, we can do a revision and we can offer another opportunity to get the goal to lose weight.
Dr. Verboonen, which procedures do you perform? Let's talk about all of the procedures, the main procedures, starting with the gastric balloon.
Okay. Well, the easy procedure is the gastric balloon, but the gastric balloon is very easy, but it's temporal.
So it's only 6 months, right, that you can leave the balloon in?
Exactly. Just 6 months and then need to be removed.
Right.
The procedure is under sedation, IV sedation, no need a general anesthesia. With a good sedation, and we can put the balloon by endoscopy, and we can remove the balloon by endoscopy. And there's no major complication with this kind of procedure.
Perfect. So Dr. Verboonen, let's talk a little bit about the lap band procedure. Remember how popular the lap band was just a few years ago?
Absolutely. A lap band is a really popular procedure. That's why all the surgeons introduced in the bariatric procedures. And when FDA approved the lap band in America, was a boom.
Yeah.
And I did already almost 6,500 lap bands. We have a good patient, good result. That's it. The lap band is for a patient with a good discipline.
So the lap band would be considered a minimally invasive procedure that takes, 30 minutes in the operating room to perform?
30 or less. It's very easy. It's a less invasive with laparoscopic and 3 incisions. It's very easy to put.
Correct.
It's a general anesthesia. We usually prefer the patient spend a night with us.
Let's talk now about the lap band procedure, and let's talk now about the revision for a lap band patient who doesn't have success with lap band. They are doing which procedure now?
Well, usually patient with lap band, and want a good option, I recommend the mini gastric bypass or the bypass single anastomosis is the best option.
Dr. Verboonen, when a patient has failure with a lap band, the next step could possibly be a gastric sleeve. We can remove the lap bands and perform directly the gastric sleeve procedure?
Absolutely. Is when we do the laparoscopic procedure, is the band is white with no different colors. We can remove the lap band and we can do the sleeve at the same time.
Okay, perfect. So that would be a revision surgery and the patients would be 2 nights with you?
2 nights, it's like the same.
Right, a good recovery. So it's not a minimally invasive, it's a more invasive procedure, gastric sleeve procedure?
Yes, it's a minimum invasive because we use laparoscopic.
Okay.
And our patients spend about an hour 20 minutes in the operation room.
Perfect.
And recovery is very easy because the patient have a laparoscopic and walk 3 or 4 hours after the procedure.
Thank you so much for taking your time and explaining to us a little bit about these procedures. And we hope to speak to you again soon about a lot of the other procedures that you perform.
Absolutely.
Thanks so much.
Nice to see you. Nice to talk with you.
You too.
Okay.